According to the Centers of Disease Control and Prevention, over 23,000 Zika cases have been reported, with 1,490 of those cases being that of pregnant women in U.S. territories. As a small population of roughly 30,000, the British Virgin Islands Health Services Authority is encouraging the public to learn about the disease, understand the symptoms, and treatment options available. BVIHSA's internal medicine internist, Dr. Jomo James, explains the symptoms of the Zika virus.
The symptoms of Zika viral infection really depends on what stage in your life you acquired the infection. The two stages that we normally think of in life are in utero, which is in the womb as a fetus, or outside the womb as a child or an adult. For a child and an adult, it's pretty simple. Usual features of the Zika infection is a rash. And the characteristic thing about the rash is that it usually starts in the face, usually not all the time, and spread downwards. Another characteristic feature of this rash is that it's quite itchy, so patients will itch a lot. Other associated symptoms would include joint pains, muscle pain, swelling around the joints, particularly the ankles, the knee, the wrist, as well as conjunctivitis, what we called red eye. Because the symptoms are non-specific, meaning that other viral illnesses, particularly dengue and chikungunya, can cause similar symptoms, the Center for the Disease Control, CDC, has come up with a particular criteria definition for suspected Zika infection. This includes someone who has a rash and two of the following features: joint pain, muscle pain, conjunctivitis or the red eye, and swelling around either the ankle joints, the knee joints, the wrist joints, or the elbow joints. If you have a rash or two or more of those other symptoms, it is advisable that you seek help from a healthcare professional to see if this is really Zika, especially if Zika is going around in your area.
Dr. James also highlighted treatment options.
The treatment options for the Zika viral infection is really supportive. Right? Majority of the times, these patients do not need to be admitted to hospital, and it's very rarely a life-threatening illness. So supportive treatment is in the form of treating the fever with fever-lowering medication or drugs, treating the joint pains as well, treating the periorbital swelling by elevating the legs or knees if the swelling is in the ankles or in the knee, and treating the muscle pain as well, again with pain-relieving medication.
The British Virgin Islands Health Services Authority is also expressing that prevention is better than cure, and Dr. James offered some effective ways that the community can help in the fight against the spread of the Zika virus.
In addition to mosquito repellents, mosquito screen, mosquito nets, there's also a third strategy that we can use: fabric treated with insecticide. An insecticide here is called permethrin. We spray on your clothes and it will repel mosquitoes as well. In fact, you can use all three strategies to prevent from getting mosquito bite and by extension preventing you from getting Zika virus.
The Zika virus was first discovered in 1947 and is named after the Zika forest in Uganda. In 1952, the first human cases of Zika were detected, and since then, outbreaks of Zika have been reported in tropical Africa, Southeast Asia, and the Pacific Islands. Before 2007, at least 14 cases of Zika had been documented, although other cases were likely to have occurred and were not reported. Because the symptoms of Zika are similar to those of many other diseases, many cases may not have been recognized. To find out more about Zika, please contact the British Virgin Islands Health Services Authority at 852-7514. I am Franka Potter from the BVIHSA reporting.